Hello, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Now, we're back to an interview. For now, we just need to clarify some topic with Dr. Roura. Because maraming nagtatanong. Marami tayong mga frequently asked questions. First, the topic, since Fat Sucker tayo, is again, liposuction. Okay? So again, our guest is, Dr. Claudine Roura. Hi, Dr. Thank you again for having me today. Hello again, everybody. It's me again. Okay, the Fat Sucker. Ito yung original ako yung pangalawa. We have a lot of questions for you, and I hope masasagot natin to. Yes, Dr. Of course, I will gladly answer your questions. Yeah, I know, marami silang always natanong. First question po, about liposuction. Okay. Most common or most frequently asked question is it safe? First question, is it safe? Yan ang pinaka-palagi nila tinatanong. Okay. Liposuction actually is very safe, especially with the modern techniques right now. Basically, when we do lipo, the term implies liposuction. We just literally suck out fat. Yes, I know when you see the lipo, how it's being done, parang medyo barbaric, no? But it's basically just underneath the skin, which is your subcutaneous tissue. You don't go inside the intestines and take out no intestinal fat. No, we only do subcutaneous fat. Okay, the visceral fat, which is inside your intestines, inside the internal organs, we don't touch that. Okay, that one is actually taken care of by the diet and exercise portion of your weight loss. It's very safe. So, huwag na kayo masyadong matatakot. Now, palagi ito tinatanong ng mga patient, what will be the downtime? How long will they be out of commission? Downtime. Okay. So, yeah, palagi nila tinatanong yan. They always ask the question, what's the downtime? We have actually a video that we did. What to expect immediately post-op. Basically, for example, for just lipo, most of the liposuction that we do is actually just an outpatient procedure. So, you come in the morning, it's a day surgery, then later in the afternoon, you just go home. When you go home, the downtime here is because immediately after the procedure, you receive your results. No, wow, wala talaga, flat ka agad. However, within 24 hours, the swelling will set in, no? So, mamamaga siya. And you will tell me, Doktora, wala po nangyari, malaki pa rin siya, malaki, magang-maga, ganyan. That's normal. That is already part of your downtime. That's already part of healing. At the same time, tatanungin nila, kailan na sila pwedeng pumasok. Normally, sometimes I tell them, actually, you can actually do it over a weekend. For example, have it done on a Friday, by Monday, pwede ka nang pumasok. Okay? So, it's that simple. Especially if you just do table work. For example, pagpasok mo, nasa computer ka lang. In this case, mas madali yung go back to work mode mo. Especially kapag tapos na yung mga leaking natin, you can freely move. Kasi because the worst feeling is actually in the first 3 to 4 days. Yun yung part na bugbog sila. Worst feeling is in the first 3 to 4 days. Most swollen in the first 2 weeks. After 2 weeks, the swelling slowly goes away. We see 50% of your result on the first month. You lose another 25% on the second month and another 25% on the third month. Until your final result is actually on the 4th to the 6th month. And sometimes, even after a year, mas gumaganda pa rin sila. Ganun talaga. Okay? So, the initial downtime lang talaga niya is actually around 3 to 4 days when you have all the leaking and kapag yun yung time na masakit siya. Okay? After that, you can move around, you can go back to work, kaya na naman ng katawan as long as you are in your compression, as long as in your binder. So, mabilis lang pala, no? Na di mo na kailangang mag-leave ng matagal. When can they work out? Yun ang next question nila. Siyempre, kaya nga sila napapasexy, di pa, para ma-maintain nila. Now, in workout, so kailan sila pwede na usually, I tell them, on the second week, you can do light workouts na. Unti-unti, for example, siyempre, medyo na pahinga ka. So, unti-unti, as long as as tolerated. I told them, you can work out as tolerated. Is it painful? As I said, yes. Okay? Bugbog ang pakiramdam niya. It feels like a very, very bad workout. Alam mo yung bago ang workout, masakit na itong katawan mo. It feels that way. It doesn't ache constantly. For example, hindi po nakaupo ka lang, wala kang ginagawa, kumikirot. No, it doesn't do that. No? Skin is numb, but the insides are tender and sensitive. So when you get poked, that's the time it actually hurts. Okay? But usually, first 2 weeks lang siya na ganun. And then eventually, it fades off, it dies down because of the healing process. Will there be scars? Yung palagi tinatanong nila. No? For lipo, ang incision kasi natin for the lipo is just like, parang a ballpoint pen.
Yeah, oo. Ako,
Parang
nagpa-lipo rin ako.
dulo lang siya ng
Wala akong
ganyan.
nakita.
So, at the same time, it is actually
Talagang tago na siya.
hidden
already
in the
faded
skin
off.
folds. Okay? Kunyari sa arms, kilikili dito sa fold, sa katawan, sa ilalim ng breast, okay, sa lower part ng ganyan. So, tago siya. But initially, of course, like in any other wound, it eventually fades off. Okay? It's just a matter of time bago siya mawala. So, wag kang mainip. Okay? Just natural. It will fade off.
Thank
eventually.
you again, Doctora, for that one.
Is it permanent? Pag nag-liposuction ba siya, permanent pa siya. Hindi na babalik yung taba. Permanent. Yes. It is permanent. When you do liposuction, these fat cells are permanently gone. Okay? However, hindi kasi lahat ng taba tinatanggal. You definitely need to leave something. Hindi pwede kasi tinatanggal lahat ng lahat. Whatever fat cell is left can store fat more than 300 times its original size. If you feed it so much with a lot of calories, with the bad stuff, na tataba ka ulit. Hindi bumabalik yung old fat mo kasi natanggal na natin yun. It just so happens that you just store new fat because of the lifestyle. Don't feed it. How much weight will I lose? Yan. How much weight will I lose? But don't actually promise weight loss. We do promise inch loss. Okay? So, pag malaki, definitely,
Oh, it's not a weight loss
sila.
procedure.
Okay? So, when you actually pinch your skin this way, kapag before the lipo, after the lipo, it's going to be thinned out this way because you actually remove the subcutaneous fat for better form or for a better figure. Okay? Weight loss is a bonus. Hindi ko pinapromise that you will lose like 10 pounds, 15 pounds because as I said, we are inch loss, it is not weight loss. The weight loss is a bonus. Can they get pregnant after liposuction? Okay lang mamabuntis sila. Lipo, yes, definitely. You can get pregnant again after the liposuction. So basically, the liposuction is more of body contouring. Okay, body sculpting. Siyempre, tataba ka during pregnancy. Okay, it's not a contraindication to get pregnant. Okay, yung liposuction natin. Pag nilipo, will the skin sag? It really depends. Okay, when you have a young patient, young skin, tight skin, no stretch mark, so maganda yung skin retraction. However,
stretch
if
mark,
the skin has a lot of stretch mark, had a lot of babies, you have this abdominal apron already, well, unfortunately, the skin will not retract. Hindi siya uurong. This is the time that you actually need to do your tummy tuck. And last one for this segment. Okay? Yung may mga high blood, may mga diabetes, pwede ba silang magpa-lipo? And the answer is yes. Okay? So, preoperatively, we always do a medical clearance. We take your blood test, we get ECG, we have X-ray. So, all of this, once normal, and you have a medical clearance from the cardiologist, or if you have diabetes from your endocrinologist, then once we have the go signal from these doctors, then we can undergo the procedure. So, it's not a contraindication for that.
Thank you again, Doctora.
Yes,
that was
Doctora.
very informative. Thank you for answering our frequently asked questions.
And thank you again for inviting me, and I hope I shed light into your questions about liposuction and with our frequently asked questions that we have more questions coming up in our next segments for the frequently asked questions. Okay?
Yes, next time.
So,
stay tuned.
Okay.
And
Thank you for having
I will
me.
see you in the next segment. And again,
you.
this
Bye-bye.
is Dr. Claudine Roura, the Fat Sucker, saying,
See you in our next episode. Bye-bye. To watch more videos, please click that button down there and don't forget to like, comment, and subscribe to the Fat Sucker channel. And again, this is the Fat Sucker, Dr. Claudine Roura, saying, see you in our next episode. Bye-bye.